Hello and good evening, everyone. Welcome to today's Blue Hills Virtual Seminar. Blue Hills Virtual Seminar is a platform that allows healthcare professionals to discuss current management updates of different health-related topics for better patient care. And today's platform, is brought to you by Dankara Technologies for the LearnNat project with Blue Hills Ethiopia. LearnNat is a comprehensive platform
Recording in progress.
dedicated to offering valuable information on pregnancy, childbirth, and the initial stages of childhood development, catering to both parents and expectant parents. Additionally, Leonard offers the convenience of doctor consultations for individuals seeking professional advice. Moreover, Leonard features a marketplace that showcases a diverse range of maternity-related products, providing a one-stop solution for the needs of expectant mothers and parents. Leonard has entered into a collaborative partnership with Blue Hills Ethiopia with the primary objective of enhancing the expertise and knowledge of Leonard's medical professionals, particularly focusing on the intricate aspects of pregnancy. This strategic alliance is geared towards providing specialized training and upskilling opportunities for doctors associated with the LearnNat project. So ensuring that they are well equipped with the latest insights and advancements in the field of obstetrics. So in addition to that, Blue Hills Ethiopia is a medical consultancy company founded by medical doctors and a computer engineer, and we aim to be an influential healthcare leader in creating a skilled communities through easily accessible knowledge in preventive medicine. And I'm your host, Dr. Ihino Tadala, a general physician and first aid trainer from Blue Hills Ethiopia. Today, it's a pleasure to have Dr. Dawit Mesfin here with us to have a presentation on nutrition during pregnancy. Dr. Dawit Mesfin is an obstetrician and gynecologist. He's also the Assistant Director of Obstetrics and Gynecology Department at the Dawit Memorial Hospital. So, Dr. Dawit, the stage is all yours.
Okay, thank you, Doc. I hope you can hear me all right.
Yes, it's clear.
Okay, thank you. My name is Dr. Dawit, and today's session will be on nutrition during pregnancy, and I'm assistant professor of obstetrics and gynecology who work on Dawit Memorial Hospital. So basically, we chose this important topic because this is the most frequently asked question by pregnant mothers during their pregnancy on the antenatal follow-ups. So we better give emphasis and answer most of the questions. So basically, we chose this topic because nutrition is a very important thing for a human being, specifically for pregnant mothers. As we all know, pregnancy is more of a high demanding state, high energy requiring state for a pregnant woman. So the nutrients that she was acquiring during non-pregnant state is not going to be enough for her during the pregnancy. So as much as possible, we need to supplement her with more nutrients, micro and macronutrients. And the other most important thing that we chose this topic is because nutrition, healthy nutrition is very important, not only for the mother, but also for the fetal development. And having adequate nutrition is helpful for the mother as well as for the baby to grow. So nutrition during pregnancy is the most important thing. So eating well during pregnancy is the best thing that could happen for a pregnant woman, basically. So coming to the introductory part, as we have tried to explain earlier, pregnancy is more of associated with fetal growth and development, and which is associated actually with maternal physiologic changes. Okay, so whenever we think of this fetal growth, development, and physiologic changes, everything, okay, there are micro and macronutrients that we need to supplement, okay, because as I have tried to explain earlier, pregnancy is associated with high energy demanding state. It's not only the mother that's alone, but also there is a baby or babies inside. Okay, so the energy that she was requiring prior to pregnancy is not going to be enough for her. So we need to supplement her somehow with nutrients. Okay, and as you can see on the picture down there, okay, it's called the Baker hypothesis, which means whatever we feed during the fetal life, during the pregnancy time, is going to have an impact for the baby in the future. Okay, which means whenever we have fetal undernutrition or fetal overnutrition, okay, it's going to have a permanent change on the fetal metabolic pathway. Basically, it's going to modify the genetic makeup. Okay, so this genetic modification during the fetal life will have an impact on the occurrence of diseases during the childhood and during the adult disease. Okay, so for example, if you take diabetic mellitus during pregnancy, GDM, okay, those with poorly controlled glycemic control will end up in complications like macrosomia and so on and so on. And the end result is going to be after delivery, okay, the risk of having childhood obesity, childhood type 1 diabetic mellitus, and so everything is related to the fetal condition during pregnancy. Okay, so many questions remain unanswered because, as I have tried to explain, this is called the Baker hypothesis. It's not as such a well-proven hypothesis, but the reason behind is most of the researches are very limited during pregnancy. Okay, you know, pregnancy is somehow it's very difficult to do researches because of ethical and practical issues. Okay, and due to maladaptation, maternal adaptation to pregnancy, there is some kind of individualization. For example, the food that is very important, very suitable for one pregnant mother might be a very difficult thing for another woman. Okay, so basically we cannot perform a specific type of nutrition test for a pregnant woman, which is under ethical consideration. And also, we do not have a proper, a good animal model that actually mimics that of a pregnant woman. So the nutrition researches that are done in the worldwide, they are somehow limited. Okay, so basically, we do have a limited testers, we do have a limited researches that we can apply for a pregnant woman. So the other thing is, whenever we think of nutrition during pregnancy, always we need to consider what's going to happen, what has to be happened during the pregnancy, before pregnancy, which we call it the pre-conception period. Okay, so preconception, any mother actually has to have preconception care before she gets pregnant. The reason behind is not only nutrition factor, but also we need to assess a woman for any chronic illnesses like diabetic mellitus, renal disease, cardiac disease, any uterine anomalies. Everything has to be assessed. Not only this one, we have to screen her for important things like DIM, STIs, STIs, and also other metabolic diseases. Okay, and the other most important parameter of preconceptional care is assessing the woman for nutritional status. Okay, so basically nutritional status assessment includes different factors, but the most important thing to consider is we need to check for a woman for medical and surgical histories. Okay, so taking this important history will help us to pick out some of the most abused drugs, like for example, if she was taking any cigarette smoking, if she's dependent on alcohol or illicit drugs. Okay, before pregnancy, we need to give her proper counseling on limiting and avoiding these important risks. Okay, because in the long term, during pregnancy, these things will have important impact on the fetal life. Okay, the other most important thing is assessing the surgical aspects. Okay, for example, if the woman has any surgeries, bariatric surgeries, or any gastrostomies, or any GI surgeries, okay, which meant to remove some part of the intestine or stomach. For example, those patients with total gastrectomy, some part of ileal surgeries, and so on. Okay, these patients will have a defective in absorption of important nutrients. Okay, So basically, we need to pick this medical and surgical histories before we let the woman for pregnancy. Okay. And the other most important thing is we need to assess prior history of the complications during pregnancy. For example, if the woman has prior history of neural tube defects, okay, it means like she was having a deficiency of folic acid, okay. So basically, prior history of DM, prior history of hyperemesis gravidum, and so on, okay. So basically, these things are conditions that are related to food related problems, okay. And the other most important thing is we need to give the woman to train herself for having important dietary questionnaires, okay. So that this is the most common thing that's practiced in the Western society, okay, which we are not actually practicing, but in the Westerners, physicians give this dietary questionnaire for their clients, so that these clients will fill up these questionnaires, okay, and they'll bring back to the physician, and the physician will assess the amount of calories that the woman is going to have, okay. I mean, the content of the food, whether she's taking adequate amount of proteins, vitamins, minerals, and so on, okay. So these are self-questionnaires important to adjust the nutritional aspects during pregnancy. So as you can see here, we do have some medical conditions that we need to ask as on the previous slide: obstetric histories, diabetic history, inborn metabolic disorders, okay, surgical histories, GI conditions, and nutritional issues. Okay, basically whether she's obese, overweight, or undernourished, malnourished. Okay, these all things has to be addressed before the woman tries to conceive. So that, for example, if the woman is obese, okay, we need to provide her with some advices in order to decrease her weight, okay, because obesity, not only during pregnancy but even out of pregnancy, will have impact on the reproductive life of the woman, okay. So basically these are the things that we need to assess. The other thing is to do physical examinations, okay. Physical examination is very important before pregnancy, in order to assess the woman, okay, for proper nutrition advice. So as you can see, the most important thing in pregnancy is the preconceptional weights, okay. So if the woman has during the preconception, if she's overweight, okay, which means actually BMI more than 30, okay, BMI actually between 25 to 30 is going to be overweight, okay, and above that we do have some class 1, class 2, class 3 obesity, okay. So basically these women will need to have proper counseling while we are assessing them on the preconception time, okay. So because most of the problems, for example, a woman who is overweight, okay, will have a problem with her baby to have neural tube defects, spinal bifida, risk of heart defects, fetal heart defects, risk of acquiring gestational diabetic mellitus, okay, and risk of pregnancy complications. Generally, pregnancy complications are going to be higher, okay. For example, the risk of being preeclamptic, the risk of having preterm birth, okay, and high blood pressure. These all are complications associated with pregnancy, okay. So before pregnancy, we need to tell them to adjust their weights, okay. Even in the contrary, if we see those women who are underweight, okay, the risk of having a baby with premature birth, okay, low birth weights, all are these complications are associated with weight, okay. So preconception period is the most important time to allow the woman to adjust her weight, basically, okay. And the other, as I have tried to explain earlier, we have to screen them for signs of nutritional deficiency, medical disease like diabetic mellitus, thyroid abnormalities, and so on, okay. So today, basically, the component of this slide, this presentation will be on appropriate weight gain and also we need to assess for consumption of variety of primary whole or unprocessed foods, okay? And we need to see some appropriate vitamins and mineral supplementation. And finally, we are going to see on safe food handling. Okay, basically, these all are meant to be on pregnancy. Okay, so as you can see in this slide, we have a table here. Okay, so BMIs who are pregnant women, who are non-pregnant women, who are underweight, basically with BMI of less than 18.5. They need to have pregnancy weight gain of approximately 12.5 to 18 kg. Okay, so basically this increment in the weights during the first trimester and this in the past first trimester, which means in the second and third trimester, is going to be very different. Okay, usually we expect more weight gain during the second and the third trimesters. The same thing when you see normal weights, pre-pregnant women, like those with 18.5 to 24.9, okay, the amount of weight gain has to be from 11.5 to 16 kg, okay? And this is in the first trimester is going to be different with the second and third trimester, okay? And the other most important thing in order that we need to see here is usually even if she is having a baby inside, it doesn't mean that she has to increase her meal at a time, which means she doesn't need to eat for two. Basically, we advise her to eat at least twice of a healthy diet. Okay, basically we don't need quantity, rather quality is very important thing that a pregnant woman has to see. Okay, so the other most important thing is the calorie requirement during pregnancy. So during pregnancy, a pregnant woman need to have additional of 340 to 450 kilocalorie per day. Okay, and this kilocalorie per day is going to be in the first trimester. If it is calculated in the first trimester, it's going to be around 2,115 kilocalorie per day. Okay, and it's going to be in the second, third trimester. Somehow it's going to be increased to 2,275 to 2,356 kilocalorie. Okay, we don't need a pregnant woman to have increased calorie or during the first trimester. Rather, more calorie requirement is going to be important in the second and third trimester because the demand is going to be very high, and we expect weight gain of the fetus more on the second and third trimester. So the calorie requirement is going to be higher in the second and third trimester. Okay? So the other most important thing is the dietary recommendation. Okay, so we do have two types of nutrients. We do have macronutrients and micronutrients. Okay, so among the macronutrients we have the proteins, carbohydrates, and fats. And on the micronutrients, we do have this listed amount of micronutrients. So basically, a pregnant woman need to take a balanced diet, which is a combination of these macronutrients and micronutrients. Okay, and we do have a proper and limited amount of nutrients that she should take during a day. Okay, which means we don't need to increase or the amount, which is excess amount of some micronutrients might lead to some complications to the fetus, which is there could be some kind of teratogenic effects. So we need to have a proper and adjusted amount of these macro and micronutrients during the pregnancy time. Okay, so when you come to macronutrients, the first macronutrient that we need to see is the proteins. Okay, so proteins basically could be acquired for a pregnant woman with a listed amount of food, for example, from the egg, peanut butter, chickens, red meats, okay, oats, yogurts, and milks could be a very important source of proteins. Basically, during the whole pregnancy, okay, we need around 1 kg of protein, okay, which means around 1.1 gram of protein is needed per kg per day. Okay, so basically, pregnant women need to have at least to consume at least one of these foods in order to gain the amount of protein required. Okay, and the other most important thing is those who lack protein actually, and basically we don't recommend like protein shakes, protein powders, and so on in order to attain protein during pregnancy, because these powders, they are commercially prepared fortified proteins. They may have some kind of complications for the mother as well as for the baby, because we don't need extra protein. Extra weight gain is very dangerous for the woman. Okay, and we don't need fortified type of proteins, because they may have some teratogenic effect as well as unnecessary weight gain for the fetus at appropriate gestational age. Okay, so basically we need to take this listed amount of proteins, listed type of proteins during pregnancy, not commercially prepared powders, protein powders or milkshake and so on. Okay, so, and the other most important thing that we need to see is the carbohydrates. Okay, so carbohydrates basically we do have as compared from the non-pregnant states. Normally, the non-pregnants require around 130 grams per day, but during pregnancy, this should be increased to 175 grams. Okay, and we do have different types of carbohydrates: the whole carbohydrates and processed carbohydrates. Normally, for pregnant women, it is important to have the whole carbohydrates, okay, rather than the processed carbohydrates. Okay, because the reason behind these whole carbohydrates, they do have the fibers inside them. Okay, while these processed carbohydrates, these fibers are taken out. So basically, we do need these fibers to prevent some kind of constipation. Okay, so basically we advise or recommend pregnant women to have a whole carbohydrate rather than these processed carbohydrates. Whole carbohydrates means basically fruits, vegetables, and cereals. Okay, as you can see on the pictures. Okay, she has to take some kind of whole cereals like fruits, vegetables, and so on. Okay, but processed carbohydrate like bread, white bread, chips, crackers, pastas, and these things, okay, they tendency to cause overweight, okay, or unnecessary weight gain to the baby as well as to the mother are very high. Okay, so basically we do recommend pregnant women to have a whole carbohydrate rather than a processed carbohydrate, due to the reason of weight gain and due to the reason of acquiring the fiber inside of them. Okay. The other most important part of this macronutrients is fats and the oils. Okay, so basically fats and oils, there is no such optimal type and quantities that's going to be recommended during the pregnancy time, but we do have lists of some unnecessary and dangerous types of fats that shouldn't be advised during pregnancy. For example, trans fatty acids. Okay, those women who consume like burgers, pizzas, some fried things, and so on, these things contain these trans fatty acids, and the tendency, as I have tried to explain earlier, the tendency to increase unnecessary weight gain for the mother or to the fetus are very high. Okay, and the other things are fish. Okay, fish is very recommended for a pregnant woman because they do have fatty acids, and fatty acids are very important things. Okay, so fatty acids could also be gained from the olive oils, avocados, and so on. Okay, but we don't have a list of in our country. We don't have a list of fish that we consume, but there are some fishes, as it is written on the box. You can just check that one. Okay, there are some fishes which we don't recommend during pregnancy because of the high levels of mercury that they have within inside of them. Okay, mercury, because mercury is associated with some serious types of birth defects. So basically, if we are just using some canned type of tunas and so on, fishes, okay, it's better to check the type of fish that we are eating because of this level of mercury inside of them. Okay. The other most important thing that we should still include in the fats is omega-3 fatty acids. Okay, these omega-3 fatty acids, they are naturally occurring fatty acids that are found in some type of fishes. Okay, and they're very important for brain development before and after birth. Okay, so as you can see from the pictures, this image, okay, contains this omega-3. In fact, as we all know from the OPDs, we do recommend them to take prenatal vitamins. Okay, so one of the most important component of these prenatal vitamins is omega-3. Okay, those prenatal vitamins that contain omega-3 fatty acids, fish oils, they are the most important and that we need to recommend to take during pregnancy. Okay, so I'm going to share this. I think I'm going to share this slide, or the coordinators will share this slide, so that you can have a better insight of the image while you are counseling the pregnant women during their antenatal visit. Okay. So coming to the micronutrients, we do have a lot of micronutrients, basically. Okay. As we have tried to explain, micronutrients are vitamins. Okay, the irons, the calcium, the phosphorus, zinc, okay, folic acid, okay, all are these are components of micronutrients. Why the woman needs to take, this pregnant woman need to take prenatal vitamins? Because the risk of developing this low birth weight, small for gestational age infants is very low while women are taking these prenatal vitamins. Okay, but the most commonly asked question is, while I'm doing on my OPD visits, is clients sometimes ask whether if they are able to take more prenatal vitamins in order to compensate the deficiencies. No, basically we do not recommend to take the above the recommended dose of prenatal vitamins during pregnancy, because even though they are very important for the mother as well as for the baby, they do have severe side effects when they are taken in excess amounts. Okay, so we're going to see some of the vitamins which cause some kind of teratogenic effect for the fetus, but even though they are very important. Okay, so always we do not recommend pregnant women to take a vitamin which is more than the limited dose of the vitamin. Okay, okay, so we do have a lot of vitamins in the prenatal component. Okay, but the most important, at least a prenatal vitamin should have these 5 components, at least a minimum. Okay, the prenatal vitamin should contain iron, which is actually the minimum requirement to be 27 milligram. It should contain calcium. Okay, it should contain folate, iodine, and vitamin D. Okay, basically there are group of individuals, group of clients who are at risk for having these micronutrient deficiencies. Okay, for example, those pregnant women who are having more than one fetus, like multiple gestation, those who are heavy smokers, okay, those who are complete vegetarians, okay, substance abusers, women with, as I've tried to explain, who have surgery previously on the GI, okay, those women with malabsorption and so on, okay, they do benefit from this prenatal vitamins. So basically, we have to stress on the content of prenatal vitamins, and at least they should the prenatal vitamin has to include these key important vitamins, key important micronutrients: iron, calcium, folate, iodine, and vitamin D. Okay, so that's the most important thing that a pregnant woman has to consider. Okay, so coming to the most important micronutrient is an iron. Okay, normally irons are very important for the fetal and placental development. Okay, and not only that, as we have tried to explain earlier, okay, pregnant woman is under high energy demand. Okay, high energy demand. Okay, the amount of blood during the early during the non-pregnant state, okay, is not going to be enough while she's pregnant, because she is with someone else. So basically we need to have expanded amount of the red blood cell mass. So this is going to be attained by taking iron properly. Okay, taking iron properly. Basically, we do have two types of irons: the heme iron, the non-heme iron. Basically, the heme irons are the most bioavailable irons. They can be acquired from the meat, poultry, fish, and so on. Okay, basically, then because the non-heme iron absorption can be influenced by the other ones. Okay, we do prefer to take heme iron because the non-heme irons, the bioavailability, the absorption, everything is going to be affected by the other foods that we are going to take. Okay, so basically, we do recommend them to take heme iron, and this heme iron is going to be made by taking poultry products, meat, and fish. And the most important thing is a prenatal vitamin, okay, should contain at least 27 milligram of iron. Okay, 27 milligram. If it is less than that, it's inadequate. In fact, we do have a lot of iron preparations like iron sulfates, fumates, gluconate, and so on. But we do need to see the elemental iron form. Okay, the elemental iron form has to be at least 27 milligram. Okay, so that is the most appropriate daily requirement that a pregnant mother should get from iron. Okay, and that's those women who have diagnosed with physiologic anemia or anemia, which means like during the first trimester if their hemoglobin level is 11 gram per deciliter, or during the second trimester if it is less than or equal to 10.4, usually the requirement is going to be increased, which means from 30 to 120 milligram per day. Okay, so basically in our OPDs, in the usual OPDs, we do give or supplement them with ferrous sulfate, which contains around 65 milligram of elemental iron. So basically, they may not need it to take it every daily, at least every other days possibility to take this ferrous sulfate. Okay, because during pregnancy there is a problem with taking iron. Iron has a dyspeptic effect, okay, a GI irritation effect. So during pregnancy, the pregnancy itself, the physiologic change of pregnancy also has some kind of GI motility problem. In addition to that, the iron has some dyspeptic feature. There may not be at least complaint to that drug. So at least whenever we try to give iron, specifically just this iron formulation rather than the prenatal, the combinations, we usually have to advise them to take plenty of water, and at least if we are using this ferrous sulfate 325 milligram, they have to take it at least every other day. That's the most important way of giving iron for a pregnant woman. Okay, so these are the iron products that the iron foods that the foods that actually contain iron. Okay, for example, these are the most highly rich in iron: the lentils, the tomato juice, okay, the cereals, the egg, the red meat, okay, chicken, and so on. Okay, so basically these are the products, the food products that a pregnant woman could additionally get supplement of iron in addition to the prenatals. Okay. The others are calcium and vitamin D. In fact, calcium and vitamin D are very important for pregnant women, not only for pregnant women, but also for fetus in order for skeletal development. Okay, so basically, pregnant women need to have at least 30 milligram of calcium, okay, in her prenatal vitamin. Okay, specifically in the first trimester, she should get it because first trimester is more or less associated with organogenesis, okay, or organ formation. Specifically, the skeletal development is going to be completed within the first and middle of second trimester. So basically, this time has to be supplemented with appropriate amount of calcium and vitamin D. Okay, so the recommended dietary allowance is around 1000 milligram per day. Okay, and also calcium is very important in the prevention of hypertensive disease of pregnancy. Okay, so basically a woman who's on calcium, okay, starting from pre-pregnancy, during preconception, okay, the tendency of hypertensive disorder pregnancy to occur is going to be very less. Okay, even though there are limited data, okay, but calcium and vitamin D are also important in prevention of hypertensive disease of pregnancy. Okay, so calcium could be obtained from these foods, okay, cereals, peanuts, okay, juice and cheese, all are more important foods that could give the woman to acquire this calcium and vitamin D. Okay. So vitamin D, separately, the recommended amount of vitamin D that a pregnant woman has to get is 600 international. In fact, this amount is not only for pregnant, but also for reproductive aged women, also for lactating women. Okay, so vitamin D is very important. We do have different formulations of vitamin D, the ergocalciferol and calciferol. Basically, we do recommend the cholecalciferols rather than ergocalciferol because the D3s, vitamin D3s, the tendency to convert to active vitamin D is very fast than the D2s. So basically, the tendency to convert to vitamin D and to be effective in increasing the serum level of vitamin D is higher with the cholecalciferols. Okay, so basically we do recommend cholecalciferols, and most of the prenatal vitamins they contain this cholecalciferol. Okay, so basically we need to tell the pregnant woman, okay, with what kind of vitamin D is prenatal vitamin contains. Okay, so even though it's very important, okay, the upper limits shouldn't be more than 100 microgram, or 4,000 international unit, basically. Okay. So these are the foods that contain vitamin D, calcium, okay, the cow milk, the orange, the egg yolk, okay, the fish, the mushroom. These are important food products that actually could provide a pregnant woman with appropriate amount of vitamin D in addition to the prenatal vitamin. Okay. So the other most important micronutrient that we need to discuss and to give emphasis is folic acid. Okay. So basically, folic acid, it could have multiple benefits, but specific coming to the pregnant woman, it is very important for prevention of neural tube defects. Okay, so basically, neural tube defects are defects that are related to the spinal cord, and usually the meningomyelocele, anencephaly, spinal bifida, okay, meningomyelocele, okay, these are neural tube defects. So basically, supplementing a pregnant woman with this folic acids will help her in order to prevent these neural tube defects. Basically, the neural tube is going to be completed by 12 to 13 weeks, or it's going to be closed by 12 to 13 weeks. So if we provide this pregnant woman at least 1 month before pregnancy and 2 months after pregnancy with folic acid of the dose of 0.4 to 0.8, okay, it will prevent this neural tube defect. Okay, and these are the food products in addition to the the medications that the supplement that we gave her. Okay, so that she could gain this folic acid. Okay. Okay. The other is choline. Okay, choline is also another important micronutrient which a pregnant woman should get. Okay, usually this choline is not going to be found on most of the prenatal vitamins that we supplement the pregnant woman. In fact, most of these cholines are obtained from the products that she eats. Okay, so like spinach, meat, egg, okay, and fish are the most important food products that provide the pregnant woman with choline. Choline is very important for central nervous system development, and during the infancy life, okay, it will have an impact on cognitive function of the baby. Okay, so as you can see, some of the micronutrients, they will have impact on the future life of baby. Okay. So the other most important product is zinc. Zinc is normally important product. It will help for normal growth, okay, normal growth of the baby. Basically, symmetric IGR is commonly associated with nutritional deficiency. So basically, growth restriction, it will help us to prevent this growth restriction, okay. So the per day amount that a pregnant woman has to get is around 9 milligram per day, okay. So in addition with the supplements that you can see on the figures, okay, she has to get at least 22 milligram of zinc per day, okay. So important products are the poultry products, the cheese, the meat, okay, the bean, the chicken peas, okay, the millets. These are the most important source of zinc that a pregnant woman could get in addition to the supplements that we provide her, okay. The other most important micronutrients that a pregnant woman has to get is iodine, okay. Normally iodine, well, the WHO recommendation is around 250 microgram for pregnant and lactating. Normally, iodine is very important for both the mother and the fetus for synthesis of the thyroid hormone. Okay, why? Because thyroid hormone is very important for fetal brain and nervous system development. Okay, so if we have deficiency of this iodine, the mother will have we will have a complication like maternal, fetal, or neonatal hypothyroidism. Okay, and as you can see on the figures, we do have a fetus on the ultrasound with fetal goiters. Okay, this is due to deficiency of iodine. Okay, so basically we do have the different types of iodine. Okay, we do have the iodized form and the non-iodized form. Okay, so basically the iodized and non-iodized salts have the same amount of sodium, but the iodized salts are refined, okay, and they have added iodine that may prevent health problem, okay, that cause iodine deficiency. So basically, we do advise iodized salts rather than the non-iodized forms, okay. Okay, the other is vitamin A. Vitamin A, basically, it is recommended for both non-pregnant and pregnant, but the amount for pregnant women is around 770 microgram per day. Basically, the deficiency, we do have two extremities. Basically, in the developing nations, the commonest is deficiency, while excess is common in developed nations. We do have prenatal vitamins, but the amount is most important because the complications are related to the amount of vitamin. Okay, so 770 microgram per day is very important dose for vitamin A. We don't need a woman to consume a lot of vitamin A because of the complications like maternal xerophthalmia, night blindness, anemia, susceptibility to infection. Okay, so the dose is very important. Okay, so basically this, as you can see on the figure, okay, it is due to deficiency of vitamin A, which is called xerophthalmia. Basically, there will be ulceration of the or scar of the cornea, okay, drying and wrinkling of the conjunctiva. These are the most important manifestations of mother with deficiency of vitamin A. Okay, and whenever we come to those pregnant women who have excess of vitamin A, which means basically the recommended dose, the recommended amount is, which is if she take more than 150 microgram, okay, of vitamin A. Basically, vitamin A has different forms. The retinoid form is a very dangerous one, okay. So basically, if she take more than 1,500 microgram of this retinoid form of vitamin A, basically, as you can see on the picture, okay, the baby will have this kind of abnormalities, okay. This is teratogenic effect of this excess vitamin A. Basically, you'll see some kind of craniofacial dysmorphism, okay, cleft palate, and the neural tube defects are common manifestations of this vitamin A excess, okay. So basically, we don't recommend the pregnant women to take more than 5,000 international units, okay. Okay, so the other most important maybe that I didn't mention is liver. Basically, we don't recommend the pregnant woman to take more habitual usage of liver of animal products. Okay, the reason is this liver contains excess vitamin A. Okay, sometimes some animals contains around 59,000 of international units. Okay, basically which is excess. Okay, so we need to limit our consumption of liver during the pregnancy. Okay, basically during the first trimester where the organogenesis is happening. Okay. So the other most important part is about fluid requirement during pregnancy. Basically, the fluid is very important for a pregnant woman because one thing is, as we all know, taking plenty of water will normalize the body temperature, okay, internal body temperature of pregnant woman. It will prevent some kind of dehydration, okay, and physiologically, the gravity stress will have an impact or pressure impact over the bladder. So urination is going to be somehow affected, okay. The risk of bacterial accumulation, risk of urinary tract infection is very high. So drinking plenty of water will make the pregnant woman to frequently go to the toilet and pee. Okay, so that will prevent this urinary tract infection. Okay, and basically it will prevent some kind of constipation, symptoms of morning sickness, and to the baby, usually what we drink that's going to be what's going to be amniotic fluid. Okay, so basically drinking good amount of water will will adjust the amount of amniotic fluid as well. So drinking water is very important for a pregnant woman. Basically, beverage generally, fluid intake is very important. So we recommend a pregnant woman to take at least 2 liters of water per day, which means per 24 hours, because the additional 1 liter is going to be obtained from the food that she's going to take. So basically, fluid is very, very important part of nutrition for a pregnant mother. Okay, so basically coming to the counseling of healthy during pregnancy. Okay, we have seen most of the parts. At least we need to generally recommend the pregnant woman to eat more fruits, more vegetables. Okay, low-fat dairy products. Okay, and to have a variety of food rather than concentrating on some particular type of food. Okay, because variety of food they will going to have a different variety of nutrients, macro as well as micronutrients. Okay, so basically we do recommend pregnant women to have a variety of foods. Okay, not to concentrate on some type of particular type of food, to have more fruit and vegetables. Okay, and to have low-fat dairy products. Okay, and the other thing that a pregnant woman has to limit or avoid during pregnancy is, one thing is, as I tried to explain earlier, fish products. Okay, there has to be some limitation on taking fish products. Okay, specifically if she's not well oriented to the type of fish. Okay, because fish products, as I have tried to explain earlier, some of them may contain dangerous type of mineral, which is mercury. Okay, which has the teratogenic effect. The other is caffeine product has to be highly limited. And the fruits, the vegetables, they are very important. Okay, they has to be well washed. Okay, well rinsed with water. Okay, and dairy products, they have to be well cooked, well boiled. Okay, unpasteurized dairy products are very dangerous for a pregnant woman. In fact, the reason that we made these things because we don't give as we like the medications. Okay, for example, if the pregnant woman came with some kind of parasitosis, okay, we do have a limited hand to properly treat that parasites, okay, because of the effect of that medication on the pregnant woman as well as for the fetus. So always we need to work on the prevention. Okay, so undercooked meats has to be very cooked. Okay, and we should have to limit the sugar content while pregnant. Okay, we have to avoid sodas, desserts, fried foods. Okay, whole fat dairy products, high fat meats. Okay, trans fat is the one we talked earlier. Okay, these trans fatty acids. Okay, foods that contain trans fatty acids has to be very limited, because one thing is calorie wise, some of them are empty. Okay, and their nutritional value is very little. Okay, rather than making high discomfort for the pregnant mother, they don't add any other thing. Okay, so basically, these are the most important notices that we should give emphasis, so that we have to tell the pregnant woman to limit or avoid these things. Okay. The other last and final thing that I want to emphasize is on the food safeties that a pregnant woman has to take. If we know what to limit, what to avoid, it's going to be very easy in order to advise a pregnant woman on the food safety. Basically, she has to have a proper hand washing. Okay, uh, we have to properly advise her to cook, to consume meat, fish, and poultry products actually, which are very cooked. Okay, and we have to avoid unpasteurized dairy products, fruits, vegetables. Okay, and basically these are the most important things that we need to advise a pregnant woman during their antenatal visits. I think this is a thing that I have now. If you have any question, you're welcome, and thank you.
All right. Thank you very much, Dr. Dawit. Yeah, we can move on to the question and answer section. So, if you can access the chat box, there is already one question posted by Najat Ahmed. So it
Okay.
says,
Can you just tell me the question? Sorry, I cannot
yeah,
access it.
okay. Do we have to give folate for all pregnant mothers 1 month
Sorry,
prior
sorry.
to? Do we have
Do
to
we have?
give folate?
Ah,
Do we have to give folate for pregnant mothers 1 month prior to planned conception date, or the 1 month period is only for those with neural tube defect history?
okay. So
So,
basically, about concerning folic acid. Folic acid is very important, not only for those who have a prior history of neural tube defect and so on, but also for all of them. Okay. Normally, what's going to be different for pregnant and non-pregnant is the dose that we are going to provide. Okay. So for non-pregnant mothers, the dose is going to be from 0.4 to 0.8. Okay. And it has to be initiated during the preconception period, which is 1 month prior to pregnancy. It has to be it has to be provided for at least 3 months ahead of pregnancy, which means, once pregnancy occurs. The 3 months is because the neural tube is going to be closed up around 12 weeks to 16 weeks. Okay, so if we provide this folic acid during this period, it's going to be very efficient, so that the neural tube is not going to be closed. Okay, and for those who are history of neural tube defect, the dose is going to be increased to 4 milligram. Okay, so that's a difference between those pregnant and non-pregnant. Okay, but the duration is 1 month prior and 3 months ahead, 3 months after pregnancy. I think I
okay.
had to answer, right? Yeah. Okay.
Yes. Yeah. Thank you very much, doctor.
Yeah, in fact, this nutrition during pregnancy is the most underrated and not really discussed topic during my OBGYN residency as well as time. And even in our country, due to our developing nation and so on, we don't have a variety of food that we eat. Okay, we have a limited amount of foods that we eat in the day to day our life. So at least we need to the foods that I have posted on the slides are mostly readily available. Okay, they're available here and there. So the most important thing is, as a physician, what we should do is we have to tell them properly what nutrient is going to be obtained from some particular type of food. Okay, so some of the prenatal vitamins that we provide them might be a little bit expensive. Okay, so at least we have to help them with the nutritional advices, so that they can compensate it with the vitamins they are taking.
Okay. Okay. So now one other question that we have is by Yeluta Getachew. So Why is caffeine contraindicated? And is there a safe limit?
Normally, caffeine is not totally contraindicated. As I have tried to mention, as I tried to mention on the slide, okay, caffeine is not totally contraindicated. It is the amount is somehow has to be limited. Okay, there are different researches, there are different theories in favor of caffeine for a pregnant woman, but the amount that's going to be taken has to be at least 1 cup per day. That is the amount for pregnant women. But excess intake could have an impact because the caffeine that it takes could have a metabolic effect, like uh, just as normal normal non-pregnant woman. Okay, the caffeine has an effect over the vascular system. Okay, just like non-pregnant and adult patients. Okay, and usually these metabolic physiologic changes in pregnancies are more of related to vascular system. Okay, high demand, high cardiac output, and high everything. Okay, specifically related to vascular and cardiovascular system. So basically, caffeine has impacts on the vasodilatory activity of the vessels and so on. So we don't recommend excess amount of caffeines, uh, only in limited amounts. That's what I can say on that.
Okay, thank you very much, doctor. So Hannah Kasai asked, is there any fruits that are not advised to take during pregnancy?
Okay, so normally every fruit is advised. There is no fruit that's going to be contraindicated during pregnancy. We do have some studies, like for example, taking papaya during pregnancy is contraindicated, but that's wrong. Normally, there are a few studies that could have effect over some individuals, but the majority of the studies, research is done on papaya, for example. The reason that they contraindicate papaya for pregnancy was it contains some kind of papain, an enzyme that triggers some kind of liver type of pain. But that's wrong. That is done only in a very few individuals who have high risk for having preterm liver. But in the majority of the population, okay, we don't recommend not to use these fruits. Okay, basically, any fruit is advised during pregnancy. Okay, there is no limitation. But whenever we take not only papaya but other products, whenever we take them, it has to be in a moderate and in a moderate amount, not in excess amount. Okay, that's the only advice that I can tell on this one. But basically, there is no fruits that is contraindicated during pregnancy. Okay.
Okay, doctor. Thank you. So Johanna Tavera asked, what brand of prenatal and perinatal vitamin would you recommend?
Okay, so basically it depends on the availability. Okay, we do have different types of prenatal vitamins. For example, the one I have on the slide, for example, this one. This one is it's available in our country. It's around 4,000 per, I think 4,000 to 3,000 per. This one is a very nice type of prenatal vitamin. It contains most of the micronutrients that we have discussed, and with an appropriate amount of dosage, okay, for a pregnant woman. So basically, if possible, and if the patient is affording this to buy, okay, I think this prenatal vitamin is very important type, very actually suitable type, because one thing is it is soft gel. The soft gel means it doesn't have a GI irritation effect. Okay, it's comfortable for the pregnant woman. It contains omega-3 and fish oil as well. Okay, so I recommend this prenatal vitamin to be taken for a pregnant woman at least. Okay, and it's available in Ethiopia as well, in Addis Ababa, and even though it is a little bit expensive, but we do have other prenatal vitamins with a fair cost. still containing the proper, at least the 5 proper minerals, micronutrients. Okay, one thing that we should focus is these 5 micronutrients. Okay, the additional ones, they are better, but if we cannot attain that one, at least we should see these 5 components on the prenatal vitamin with their appropriate dosage. Okay, this iron, calcium, folate, iodine, and vitamin D. Okay, these are the most important things. Okay, I think that's what I can. And this prenatal vitamin can be taken even before pregnancy. Okay, before pregnancy, it's also possible to take. Okay.
All right. Thank you very much. So another question is by Betel Ayala. So most of the mothers we encounter may not afford to have this variety of foods and may not even afford supplement. How do we approach this?
Yeah, I've tried to answer these things. Like, for example, the foods that I'm just posting there, they're readily available, in fact. But the foods alone cannot properly is not going to be as such sufficient enough to provide all the things, the micronutrients that we want. So at least beside the food that we advise them, at least we need to tell them to have a vitamin at least that contains these 5 things. Okay, these 5 things. Normally we provide these prenatal vitamins because this pregnancy is somehow high demanding state. If the woman is well nourished, okay, if the woman is well nourished before pregnancy, okay, we might not even think of giving them. There are people who are not taking prenatal vitamins throughout their pregnancy and have no complication at all for her as well as for the baby. Okay, but at least in our population, in our country, okay, and in some countries where prevalence of some micro deficiencies are higher, for example, in states where there is high iodine deficiencies, okay, or the prevalence of iodine deficiency is higher, we need to prevent them, okay, more level of iodine. In states, in places where the anemia level is very high, we need to supplement that more iron supplementation. So basically, I don't think the foods that I post are a little bit difficult to reach on. Okay, like for avocado and oils and so everything. I don't think they are a little bit difficult to attain, but still, something that we need to know is the foods that are not as such by themselves sufficient enough. Okay, we need to supplement them with more prenatal vitamins. That's the most important thing that we do. If she didn't afford, there is nothing that we can do. But at least we have to be sure that the 5 components of micronutrients are addressed. Okay, so at least we have to give them options concerning those 5 micronutrients. Okay, if she is able to attain at least iron level, okay, the calcium level, okay, and at least the calcium, the iron, the folate level, that's very important. That's enough, at least, okay? But it has to be holistic approach, basically, with food, with prenatal vitamins, both together.
Other is what kind of tuna is not recommended?
Normally, yeah, I've tried to mention some of the products of fish that are contraindicated during pregnancy, okay? So, I don't know whether they're properly written on the tunas or not, but tunas that are made of the mentioned on the box, the mentioned fishes, okay? So these are contraindicated for a pregnant woman, okay? The reason is having high level of mercury, okay? And mercury being a teratogenic factor for the fetus. So basically, that's why I'm just trying to mention generally as tunas or fish products has to be a little bit limited, okay? Has to be a little bit limited, unless otherwise we are able to differentiate what type of fish or tuna is being made of, okay? So otherwise, the tunas, they could have a labeling, okay? So if the labeling is not related to the mentioned type of fishes on the orange box, okay, then they are not contraindicated. But if they are into this box, okay, usually we don't recommend them due to the high level of mercury. So basically, if I'm not sure enough, my advice is if something is not sure enough, it's better to avoid it rather than taking a risk on that one. Okay, so if it's a limited amount, there is no problem. But at least most of the complications are occurring when we are taking something in excess amount. So basically, let's try to rule out the type of fishes, okay, or tunas that we have, and if they are out of the mentioned ones, okay, it's okay to take. But if you are having some kind of doubt, it's better to refrain from that one. That's my advice actually. Okay, because in a country like us, okay, we may not have proper labeling, proper instructions instructions on everything that we are eating. So basically, we have to be limited on these things. So that's what I can say concerning fish and tuna. Okay.
Okay, one last question, Doc.
Okay.
It is when is the ideal time to start taking multivitamins during the prenatal period?
Okay. So basically, there is no such timing to take prenatal vitamins. In fact, they are not medications; rather, they are supplements. Okay, so basically, a woman who is trying to conceive, who is trying to have a baby, okay, she can take preconception vitamins at any time T. Okay, and she can try. Okay, some of the women might take for 2 months, 3 months, but the only most important thing is just fulfilling the store, okay, the store of the woman, basically, okay, the nutrient store of the woman. So basically, she can take at any time. See, they are not medications; they are supplements. Okay, even not pregnant women, other adult population are currently being advised to take vitamins at any time. T. So basically, there is not such a recommendation to take multivitamins before pregnancy. But concerning folic acid, okay, concerning folic acid, which is one of the most important micronutrients, she has to take before 1 month, at least 1 month prior to pregnancy. She can't take more before 2 months, 3 months, anything, okay, but at least before pregnancy, we recommend her to take for 1 month. Okay, that's the most important thing concerning folic acid. So for multivitamins, we may not have such a strict timeline to say before pregnancy. Okay, she can take at any time, not even to try pregnancy, but at any time if she's not even pregnant. Okay, even adult population, male population, aged population, specifically perimenopause, menopausals, they are currently being advised to take these prenatal vitamins, multivitamins generally.
Thank you very much, Doctor. So on behalf of, I think we are done with the questions. We have addressed all the questions written in the chat box. So
Okay.
on behalf of Play Health Ethiopia and all our participants and also the LearnAt project, I would love to thank you for taking the time and giving us this wonderful and insightful seminar on nutrition and pregnancy. So we hope to see you with related topics in the future as well. So if you have anything at last that you want to address, let me give you the stage one more time again.
Okay, thank you for giving me this chance as well. Okay, it's very honorable to give this lecture for those who are in the front line to face pregnant women during their antenatal care. So I think this slide will help you, and this presentation will help you or at least to lead you to advise them on a proper nutrition counseling. And thank you very much. That's it.
Okay, thank you very much and good night, Doc.
Good night. Bye.